The BAME Vision logo, 4 solid circles from left to right in colours of brown, tan, coffee and beige, with the words BAME written in white within them, with the word Vision written in tan underneath, and below the words Supporting Ethnically Diverse Communities with Their Eye Health and Sight Loss in brown.
I'd like to introduce Louise Gao, clinical lead for eye health, and you're also an optometrist. But Louise, thank you so much, and thank you for being our professional speaker today. And please do introduce yourself, and thank you for presenting today.
So thank you very much for inviting me to speak again. So my name's Louise. I am, as Bhavini says, the clinical lead for low vision eye health and optometry at RNIB. I've been with RNIB for nearly 15 years in various capacities, but my background is I'm an optometrist. I've been an optometrist for 30 years as of last month, and I've worked in lots of different settings, primary eye care through to hospital eye care, and I also do some work in special schools testing the eyes of children who have autism. So that's my background. Bhavini's asked me to speak about driving and vision. This is always a really tough subject, and as Bhavini sort of mentioned earlier, not being able to drive the car, and particularly if you've previously been able to drive a car, is a real difficult time for people. And next to telling someone that there's something wrong with their eyes, I think telling someone that they really don't meet the standard for driving is one of the toughest bits of my work. Um, it's a bit of a dry subject here because there's a lot of legal stuff around it, but unfortunately that just is the nature of the thing. So so do bear with me. I'll try and make it as interesting as possible. So Bhavini set the question, can you drive if you have sight loss? And the answer is yes, but only under certain circumstances. So today I'm going to go through the law as it stands and what that really means, and what you have to do if you think you're if you don't meet the standard or potentially might not meet the standard. So I say yes. So there are lots of people who have eye conditions, who have a diagnosed eye condition, that are still eligible to drive. So as long as you meet the requirements for the vision standard for your license category, and as long as you're wearing the spectacles and contact lenses that are prescribed for you to reach that standard, and you've checked with your optometrist or consultant that your vision is good enough, and you've notified the DVLA. So there's quite a lot of steps there that would then result with a yes if you meet all of those levels. And we're going to go through each of those step by step. Now, this is the nasty slide, the one that I find difficult to say. But if you are driving without notifying the DVLA, and if your vision doesn't meet the standard, then you are liable for £1,000 fine. Your insurance will not cover damages incurred in an accident because you're officially driving illegally. And you could even face prosecution if you're involved in an accident. And those rules are there to protect everyone. They're there to protect the person concerned, but also anyone that might be injured as a result of someone driving that shouldn't be driving. So it's quite a serious matter. And I think it's really important for people to know what the risk is if they don't notify the DVLA. So even if you don't have an accident and the DVLA somehow find out that you're driving and your vision isn't good enough for driving, you could be fined. It could be as serious as that. So there are other sort of variations to what I've just mentioned at the beginning. Classically, we get the question, if you've lost vision in one eye, that should say only. Incidentally, everything that's on the slides I'm going to talk you through, so don't worry at all if you're struggling with the slides. You won't miss anything at all. I'm going to talk through every slide. So if you've lost vision in just one eye, then you are still eligible to drive, but there needs to be a slight adaptation period. So it's still a good idea to let the DVLA know. You should stop driving until an eye care professional says, yes, it's okay for you to start again. And that can be anything really up to about 6 months. And it's really important because if you lose an eye or lose a substantial amount of vision in an eye, it means that you don't have good depth perception. And depth perception also is the skill that you, or the ability that you use in order to judge speed and distance. So it's quite an important factor when you're driving, but you can meet the driving standard with just one eye. So it will just be a temporary stop on the driving license. You need to notify the DVLA if you have an eye condition that affects both eyes and might affect your ability to drive. So going back to those criteria at the beginning, if you've got glaucoma diagnosed just in one eye, then you don't need to notify the DVLA. You would only need to notify them if it's in both eyes, or if you have a particular eye condition that just affects one eye, then you don't need to tell them, as long as your other eye is still very good. If you're in doubt, then tell the DVLA. It's better to let them know and to have peace of mind that you're not doing anything that you know you shouldn't be. I think the biggest take-home message is exactly that. If you have an eye condition in both eyes that might affect your ability to drive, or your only sighted eye, you develop an eye condition in, then please do tell the DVLA. If in doubt, tell them. That's the biggest take-home message of all of it. So there are some groups of eye conditions that you are absolutely obliged to tell the DVLA. You must tell them, and most of these groups, they will tell you that you must stop driving until you've had the relevant assessments. So blepharospasm is the first one. Blepharospasm is where the eyelids close with involuntarily, so you've got no control over it. It's like a twitch, a muscle twitch, but it closes the whole eyelid, and as you can imagine, driving a car with that happening is very dangerous. There are treatments for blepharospasm, but until that's managed, then it would be a no to driving. Diabetic retinopathy is the next one. Diplopia is the medical term for double vision. So the next one is double vision. If you see two and you can't control that, then it's a definite no for driving until something is done about that situation. Glaucoma, if you have glaucoma in both eyes, is another one you must tell the DVLA. Nyctalopia, that's a fancy term for night vision loss, and it's usually associated with retinal disorders and inherited retinal disorders, or laser treatment. And retinitis pigmentosa is the final one that you must tell the DVLA if you have those conditions. I want to just touch on a few myths here, because a lot of people that I see in clinic that I've said to them, you know, you really need to let the DVLA know about this. They'll come out with some set lines, and I'm just going to mention them. The most common one is it's only locally. I'm only driving locally, or I don't go on the motorways, or I can't get about without my car, and really difficult one, I'm a carer. And if you're caring for someone who particularly has physical disabilities, not being able to drive a car is a huge problem. And I'm not belittling any of these statements. They're absolutely true. We know that obviously if you can't drive a car, it really limits where you can live, where you can work, how you get about. And so, you know, I'm not saying that these aren't valid statements, but they're not valid statements to mean that you can continue driving even if you shouldn't be. And particularly the only local one, people I think often think that if they're driving locally, they know the road, so it's going to be safe. But local roads often have lots of little children playing, lots of people walking around, shops, etc. So it's probably one of the worst places you could be driving if your vision isn't good enough. And it's very tempting to say, oh, you know, I'll only tell the DVLA when I absolutely have to, when I absolutely know that I shouldn't be driving. But I would encourage you not to do that. So my next slide is not coming up for some reason. There we go. So I want to give you a little bit of good news now. So lots of people have to notify the DVLA that their vision might be affected by an eye condition, and they meet some of those criteria that mean that they have to notify the DVLA. But nearly well, a high percentage, I don't know the numbers, a high percentage will be told by the DVLA that their vision is good enough for driving. And usually they have to go through a couple of tests, which I'll talk about in a little bit more detail later. But they're a visual fields test on a test called an Esterman program, and a visual acuity, so how well you see on the letter chart with your contact lenses or specs. And it just confirms that actually, yes, you might have glaucoma, but your vision is good enough for driving, and that's fine. So just because you're notifying the DVLA doesn't mean that they will automatically take your driving license away permanently. They might take it away temporarily until those tests are done, but they won't take it away permanently until your results on those results come through. And as I say, for a lot of people, it's good news. It's not bad news, and it means that they are driving legally. So let's look at these requirement for the level of vision. So these requirements that I'm going to talk about now, so these are the criteria for driving. The ones I'm going to be talking about are specifically for car drivers only. If you have a license to drive a bus or a lorry or something like that, the rules are the same or tighter. So they obviously, if you're driving a much more dangerous piece of vehicle, then they're going to have to be slightly stricter on the rules. So if you are in those categories and you want to know about that, then the DVLA set out that criteria on their website. So to legally drive a car, you must meet the eyesight criteria set out by the DVLA, and you must declare any underlying health or eye condition that you've acquired after you passed your driving test. So so this applies to sort of health issues as well, which obviously not our topic today. On this slide, I've got a picture of a letter chart. So we've got big letters at the top, gradually reducing in size down to the small letters at the bottom, and they're black letters on a white background, a standard eyesight test. It's called a test of visual acuity. And it's our sort of standard test of your ability to read detail. The level of vision required to pass the driving vision standard test is 6/12, which is the Snellen acuity, or 0.3 logmar visual acuity. And it's approximately 2/3 of the way down a standard letter chart. So it's quite a tough criteria. And to put that into perspective, most people who are registered as severely sight impaired are unable to see the top line of a standard letter chart at 6 meters. So that's the level that's required, 6/12 or 0.3. If you want to think about it in meters, it's the ability to see a number plate at around about 20 meters. The old-fashioned number plates, it's 20.5 meters, and the more modern number plates, it's 20 meters. I would encourage you to ask your optometrist to measure that vision rather than estimate from a number plate in the road. It's still a good test, but it's better to actually get that 6/12 tick in the box. In addition to that, you need to have a 120-degree visual field horizontally. So you need to be able to see 120 degrees side to side. And the central 20 degrees of the visual field has to be full. So I think you can get away with one spot missing on a visual field test. But most of the central 20 degrees needs to be completely clear when you're looking at it both eyes open. So the test that they use is called an Esterman test, and it's a visual field test that you do with both eyes open. And it's, if you like, it's a way of testing the functional vision of your functional visual field. So how well you can see when you've got both eyes open and you're driving a car down the road. If you are using a prism or a patch to control double vision, do you remember I said back at the beginning, if you have double vision, then you must notify the DVLA and you must stop driving until the double vision has been resolved. They require you to wait 3 months to adapt to the patch or the prism, to know that the double vision has really gone before you start driving, and you've got used to any depth perception problem. So that's a requirement. So if you're correcting your vision with a prism, then it doesn't matter whether you've got 120-degree field and good visual acuity, you still wouldn't be able to drive for about 3 months. And that's when an eye care professional would tell you that you're safe to drive again. And if you've had a stroke, you have to wait a month and then only start driving if there are no lasting effects of the stroke. And again, an eye care professional will assess your vision and make sure that there's nothing that could be, could be breaching those requirements. So a couple of little additional comments around the requirements, the eyesight requirements. Eye care professionals and medical professionals are obliged to break confidentiality if there's a reason to believe that you're driving and you've been told not to. So if I see a patient and they've got their car keys in their hand and they go out of my practice door and start up their car engine, then I would be obliged to tell the DVLA that I'm aware that that person is driving. So just to let you know, that's one of the few occasions where the patient doesn't have to consent to information being shared. And actually, there's some quite serious consequences for eye care professionals if they don't let the DVLA know that. I mean, obviously, we wouldn't do it without telling you first that you shouldn't be driving and giving you that opportunity to not drive. You may not drive if you're registered as sight impaired or severely sight impaired. And I think most people would know that, but I think it's really important to mention it because some people will hold off being registered because of the driving license. And that doesn't change what level of vision you have. The registration is just simply a way of getting you into the support that you need elsewhere. Sorry.
So you're going to be
Sorry,
recorded.
someone's joined. Can we be on mute, please?
Yeah, sorry.
Okay.
Okay. Yeah, so registration is simply a way of getting the support that you need if your vision has deteriorated. It's a set criteria, just like the driving standard. And if you meet the criteria for registration, then you simply won't meet the driving vision standard. So it doesn't matter how long you wait for registration, you still wouldn't be meeting the driving standard. So you'd still be obliged to tell the DVLA. And I've come across quite a number of people, and I understand the logic there totally, but it doesn't change the vision criteria for driving. So when should you actually officially stop driving? If you've been told to stop driving by your doctor or your optometrist or your eye doctors, your ophthalmologist, then you should stop driving immediately. If you feel that your vision isn't good enough for driving yourself, then you should stop driving. And if you've had a stroke or TIA, a TIA stands for transient ischemic attack. So in some cases, TIAs are very, very minor, and your doctor will tell you immediately it's fine to drive. But a serious TIA or a stroke, then you should be informed not to drive, as I say, for a month. You should also surrender your license if your doctor has told you to stop driving for more than 3 months. It's a funny little quirk of the law that the DVLA require you to reapply for your license if you've been told to stop driving for a significant period of time. And that's usually more to do with health than anything else. So how do you tell the DVLA? There's an online form on the DVLA website, or you can call the DVLA and fill in the form over the phone, or you can call the DVLA and ask for a hard copy of the form to be filled in. There's website guidance that's really comprehensive on the DVLA website. And if you're not sure whether you should be declaring something or not, there's an A to Z of conditions. You can just put the details in and it will tell you. So that covers everything from health and sight, the whole lot. The DVLA will then decide what you need to do next. You may continue to drive while this happens unless you've been told specifically not to drive, or you feel that your vision isn't good enough for driving. So and if your license is lapsed, say you've got to the age where you've got to reapply for your license, while you're waiting for that process to happen, as long as you haven't been told not to drive, you can continue to drive. And again, if you're in doubt, check with the DVLA. Always best to err on the side of caution. So what might happen if you tell the DVLA? So they may ask your doctor or consultant to give a comment on your site, maybe a report. They might give you approval to drive again. Usually that's only after they've carried out tests, but there will be some people that are declaring things that they don't really need to, and the DVLA will tell you straight away, that's fine, carry on. The tests, they may refer you to have the tests at an accredited opticians. Unfortunately, you can't have them done at necessarily at your own opticians. I think there's for good reasons really there. But unfortunately, there is only one group of optician practices that are accredited to provide this service. It's a commission service. So you'll be notified as to where you need to go to do those tests. You might be issued a license with a shorter renewal time based on the test results or and the information that you've given. You might be required to stop driving, but with a time scale at which you can then reapply for your license. Or you might be told that you really shouldn't be driving and there's no option to reapply. So those are the main outcomes and the process that happens around that. I know that during lockdown and immediately after lockdown, there was huge delays in this, and it caused a lot of distress. You know, especially when you're worried about your driving license, the last thing you need is great big long delays, and there was a lack of communication. To be honest with you, I don't know how much of an improvement there has been since that time, but I know that many people commented on the process not being as smooth as it should be. So alternatively, if you know that you should or you want to stop driving, because some people just choose that, you know, actually they'd rather not be driving, then you can fill in a declaration of voluntary surrender. I think that sounds really military. It sounds really scary, but basically it's your choice. You're saying, here, have my driving license back. And you fill that out and you send your license with it to the DVLA. I think it's vitally important that you feel that your vision is good enough to drive a car. So even if you're technically eligible, if you feel uncomfortable, if you think that you're missing things, or you're scraping the car in parking spaces and things like that you didn't used to, then I think you kind of know in your own self, don't you? And I think that's really important to then pursue that either by saying I don't want to drive anymore, or just simply by checking with the optometrist. And I think this is a really good place to say, have a regular eye test, because some of these problems can be corrected just simply with glasses. And it's not necessarily the case that as you get older, your vision deteriorates. It might just be a pair of glasses that you need. So a regular eye test at least every 2 years, or more frequently if your optician tells you you should be coming more frequently. So, in the first instance, always just check and see if there's anything that can be done to improve your vision, for lots of reasons, not just for driving. The other thing to say is that many eye conditions, technically you're past the driving standard because you can read the letters on the black and white chart and you can see, your visual field is completely full. But if your contrast is affected, so for instance, when you're developing cataracts, before you have them treated, then you might find that there's glare, that there's haze in your vision. And in some environments, particularly very bright or very poor environments, you feel that your vision isn't good enough for driving, or you feel like you turn the corner and all of a sudden the sun's in your eyes and you can't see anything. And this can make your vision very variable, but it wouldn't show up on the driving vision tests. I wouldn't necessarily suggest you hand your driving license in because you're worried about that, but I think it's something that you should discuss with your optometrist or your eye doctor if that's relevant. It might be a reason to have your cataracts treated. Or it might be a reason to say, actually, do you know what, I don't feel safe driving because my vision varies. And there are some eye conditions, so for instance keratoconus, that can cause your vision to vary from day to day in certain circumstances. And again, although you might be legal to drive, you might choose not to drive. And I think, you know, I can't emphasize that enough. If you don't feel confident, then you're more likely to make a mistake when you're driving. So you're the best judge of your vision, really, aren't you, in that respect? Sorry, there we are. So, you know, obviously the DVLA get this wrong sometimes as well, because they're just looking at bits of paper and it's computerized to an extent. And you may well disagree with the decision that they've made, and you have a right to appeal that. So if you do disagree, the first thing to do is to write to the DVLA to state that you're appealing their decision. You need to include two things: the reference number from your decision letter, and you need to include the proof that you meet the standards. So the proof that you think you meet the standards, and that might be a letter from your optometrist, it might be the results from your last hospital appointment. You might like to give your consultant a call and see if they'll back up your your just, you know, your views that their decision is incorrect. So that's the first thing to do. So, and it's definitely the best starting point. However, you also have the right to contact your local magistrate's court with your complaint, again, including the proof of your eligibility to drive and copies of any evidence that you want to submit. You have to do that within 6 months of the decision. And I would strongly suggest that you get legal advice before you take a step like this. Firstly, because it can cover some of the legal costs. And secondly, it also means that you know exactly what you're taking on when you do something like this. And in Scotland, I've just put a little note. I don't know if there's any Scots on the call, but in Scotland, you only have 21 days, and it's the sheriff's court, not the magistrate's court, that you would contact. But you absolutely have a right to disagree with the decision, and you have a right to appeal. All the details of that are on the DVLA website as well. They're very clear in the process. So it's got all the addresses and telephone numbers. So what if you're told you can't drive anymore? And as I said right at the beginning, the reason this talk is a particularly difficult one is because it's significant when you can't drive, and it is a form of loss, because if you have previously driven, then it's a limitation in your independence, being able to hop in the car and, you know, pop to the shops or go to work or visit friends, that sort of thing, and you're more reliant on buses and taxis and other people. But I think it's really important to know that you're not alone, that many people face this situation every year. And some people are never able to drive a car. There's always someone that you can speak to about this. So if it's something that's causing you a lot of distress and anxiety, then please do reach out for help, and talk to someone about how you're feeling. I'm sure Bhavini and the team will be able to supply you with routes of people to speak to. RNIB have a counselling service, and we have an emergency counselling service too. So just go onto our website or give our helpline a call if you need someone to speak to. But I'm sure Bhavini can give you some alternatives as well. The other thing to do is to perhaps speak to your local sensory needs vision rehabilitation professional, otherwise previously known as a ROVI or rehab officer. They will be able to advise you on your rights in terms of, you know, practically, well, what do you do if you can't drive a car? Are you eligible for taxi cards? What are the local services? What's there to help you because you can't drive the car anymore? And there is support there. And the rehab professional will be able to give you some advice about what you're entitled to. And I think discussing with your eye doctor whether you're eligible for registration as well. So if you haven't already been registered as sight impaired or severely sight impaired, that's probably a good point at which to have that conversation as well. Because if you're not eligible to drive a car, there's a chance that you would be eligible to be registered as severely sight impaired or sight impaired. And then that opens up options of things like taxi cards and other support. So please do consider that as well if that's the case. This is just a useful link. Hopefully Bhavini can share this with you later, but if you want to have a look at those rules, this is the government website, and it's on the .gov.uk website, and it's the driving eyesight rules. You just need to pop that into a search engine, and it gives you everything pretty much that I've talked about today. And then the future, well, we talk about driverless cars. You never know. Maybe better public transport, but unfortunately, I suspect that driverless cars might come before better public transport, especially if you don't live right in the centre of a city. So I am open to any questions at all. That's the information I have for you. I'm going to stop sharing, and I don't know, Bhavini, if you want the questions at the end rather than now.
Yeah, we'll go to the questions at the end. But thank you, Louise. That's been really helpful and useful. And you may have actually mentioned this. Do we need to inform insurance policies?
So now that's an interesting point, isn't it? I think that when you sign up for an insurance policy, I think you do have to declare that you're fit to drive. It will certainly be in the small print somewhere there, and your insurance is definitely invalidated if you haven't notified the DVLA of an eye condition that might might affect your ability to drive. So either way, even if you haven't told the insurance company, then it wouldn't be valid, and unless you've told the DVLA. But I'm pretty certain I've renewed my driving insurance so many times, and I couldn't tell you if there's a box on there to tick, but I'm pretty certain there is, because I think you have to notify of health conditions as well, don't you?
Yeah, no, thank you. I was just interested
No,
in
it's
that.
an interesting question. I hadn't thought of it the other way around. It's like, yeah,
No,
I know the DVLA are very strict on it. So, yeah.
Okay, no, great. Thank you, Louise. That was so informative. And I think it was so important to highlight. I think in your presentation, you also mentioned that, there are people for one reason or another want to cling on to that license because it is a mean of getting around to support people making those essential journeys, not for them, but perhaps for someone they're caring, young children that they're supporting, so many different reasons. But at the end of the day, it's your safety. And if the worst was to happen, it would be so much more worse. So yeah, no, thank you. I think just quickly sharing, like, I was diagnosed with RP just as I was starting to take driving lessons. And I always had this ambition that I always wanted to own and drive my own Lamborghini. It had to be a red Lamborghini. And I just was so in love with that kind of dream. And when I started my driving lessons, I remember one day in particular, my instructor slammed the brakes on. And I couldn't understand why. He asked me to drive to the nearest side road, and we were basically about to enter a tunnel, a bridge, and it was a two-way junction, two-way road. And I hadn't been able to identify or judge the size of my vehicle along with the other vehicle. So there was no way that both vehicles could pass at the same time. But I didn't realize that. So I never actually pursued my lesson. So I never actually got a chance to drive. And that it was a horrible feeling. It was a big disappointment because that's something I'd always wanted to do. But actually, you know, for people in my position who've always wanted to drive, but never got the chance to, actually there's experience days. So back in 2017, I was lucky and fortunate to come across this experience day where I got to fulfill my dream. I did drive a Lamborghini. It wasn't red, it was black, but it was a Lamborghini. And I got to ride it around several times around a lap, exceeding 125 miles per hour. And it was so thrilling. So there are other ways, but I know it's not the same as those who have been driving and for whatever reason they need to stop. So yeah, that's enough about my story. But if anyone is in a similar situation where they do want to experience blind driving, there are organizations out there. I'd like to now invite Sylvia. Sylvia's our lived experience speaker. She's actually a campaigns and engagement intern during the day. She's actually one of our BAME Vision Committee members. She is a social media content creator and she's a blind mom. Sylvia, are you there?
Hi, my name is Sylvia. I am visually impaired as well. I have uveitis. It is basically uveitis. The way I understand it is, I think maybe Louise could come back and explain it a bit better later on, but it's inflammation in the eye, and it could be in the middle layer or in the front, in the middle, or in the back, or all of it at the same time, which is what I have. So my eye is inflamed everywhere, basically, panuveitis. And I say eye actually because it's the only one that I'm currently using. I lost my vision in my right eye when I was about 5 or 6 years old, which is when I was diagnosed. Obviously, when I was diagnosed, things had gotten pretty far along, and that's because I wasn't really going for, I think, beyond being, you know, when you're born and they check your vision and everything, that's pretty much the end of it. They don't really look into it again, or at least, you know, back then, not showing my age. So what happened was my teachers at nursery informed my parents that it seemed that I was struggling to see. So they, you know, asked them to take me to get my eyes checked. And when they checked them, I think it took maybe a year, if not longer, to actually arrive at a diagnosis and maybe some kind of treatment. I think I bounced from doctor to doctor, kind of trying to figure out what to do with me. And I think what was happening also at the time, I've been told, rather, because obviously I was a child, I've been told I was quite young for my eye condition, and it wasn't something they would see it wasn't very common, basically. So I can actually attest to that, because with most waiting rooms I've been in, I've been the youngest person in there all the way up until now, actually. But I think I might be getting on in age a little bit, because there's starting to be some slightly younger people than me. So yeah, by the time I was diagnosed, my right eye was basically gone. I started treatment when I was about 6 or 7 years old, to kind of bring back my eyesight to how maybe it should be, or to improve on it, really, which was fine. They only worked on my left eye. I think they decided the other eye, there's kind of, let's focus, basically put our energy into the one that we can actually save the vision. So yeah, they did some procedures, and including one that included a lens implant, which I still have in until today. And my vision was okay. It was corrected, you know, I was functioning actually really well. I was prescribed some glasses from when I was 7. And yeah, everything was okay. Regular teenager, went to school, the usual stuff. And then at some point, obviously, because, you know, you can actually, I was like, can I actually drive? Because I could only see with one eye. And I can. And, you know, you can do those like home driving lessons where you're supervised by a person who's got a full license. So that's what I was starting to look into doing. And I'd gotten to the point of, you know, starting to be shown like, okay, it was a manual car. This is the clutch. This is what you do with it. Like, I've sat behind the wheel. I've gone around, you know, a parking lot a few times. But then that was kind of parked there, pun intended, for a while because I went into uni. So that was kind of put on pause. But what happened was about a year into uni, I actually became registered blind. And it was a bit of a shock because I didn't go, sight impaired, then severely sight impaired. It was just straight to, severely sight impaired. And I'm not sure what the process, oh, you might hear my screen reader every now and then, sorry. I'm not sure what the process or the thinking was behind putting me straight there. I'm not sure if my vision was really that bad then, because I know you can be registered one thing and then the other as time goes by, or you can just, be registered as severely sight impaired because that's where you're headed anyway in the next few months or weeks or whatever. So that was a bit of a shock for me because the only reason I even went to the doctors, okay, so I should have mentioned actually, between when I was about 15-ish, I would say teenagehood kicked in and I just didn't want to go to the hospital anymore. I'd had enough. So I stopped going. I wasn't getting my regular eye checks or anything. So, my vision was not being managed. My eye condition was not being managed with anything. So being registered as severely sight impaired eventually, I suppose, I didn't really think about it then, but I suppose that's where it was really headed. But when I was registered, I still felt okay. I was still wearing my glasses. I was still functioning pretty well. So I didn't really make any kind of changes to my lifestyle, to maybe, I don't know, learning mobility skills. I didn't do I wasn't using magnifiers. I'm just listing a couple of things that I do now that I wasn't doing then. So yeah, so nothing much happened in that department. I was just registered blind and, life moved on. I think the turning point for me was my vision, taking a huge downturn after having my first child and then my second one. And I don't know if that was really, for me, it's the marker, because that's when it happened. I don't know if it was going to happen at that point anyway, I'm not sure. But what happened and I learned then, I didn't know this, with uveitis, you get flare-ups. And these flare-ups are, I think, again, maybe Louise might come back and give you more accurate information on this, but I think it's when the inflammation increases. And I hear the doctor say something about increased inflammation cells in my eye. So yeah. So when that happens, you get blurred vision. Some people, I only get blurred vision. Some people get severe eye ache and eye pain, and my eyes go red as well, which is another symptom of the flare-ups. So with the blurred vision, it kind of, the best way I can explain it is I just know the lights are on or off, and it was a bit of a shock, really. It was it's something I hadn't experienced before. I didn't know that was something that could happen with my eye condition. In fact, I thought, my eyes are gone, my remaining eye is gone and that's it. But I've learned, because I've had many flare-ups since then, that it's something that happens. Inflammation does go up and down and so on and so forth. And yeah, you do improve from the inflammation and come back to what is a usable vision. But what had happened is with each flare-up, my vision would come back, but not to how it was before. So I would say between when I was registered and now, my vision has basically reduced by at least another 20% or so. Like I have 3 to 5% eyesight left in my acuity, I'd say, left in my left eye. So that's what it's 5% on a good day, and it's 3% when maybe I'm tired. There are so many different factors that affect my how I'm able to see and everything. There's maybe lighting, maybe if it's too bright, if I've been somewhere that's too bright for too long, so I've had to learn to wear sunglasses all the time. If I'm somewhere that's a bit too dark, then maybe I would definitely struggle. I have night blindness. I can't see anything at all in the dark, except for light. If a light is switched on somewhere, or if there's a street lamp, for example, maybe headlights, I don't know, a shop window, things like that. So I can see those things when I'm outside in the dark, but anything else, I hear people, see people and things in the ground. I don't know, haven't experienced that for a long time, actually. So actually, when I was registered, I already had night blindness. I just kind of didn't realize it. I just thought I need to wear my glasses, which I didn't at night. So yeah. So yeah, I would say culturally, what I've encountered or what I've experienced is I would say some people have basically questioned, you know, oh my gosh, she's visually impaired, she's blind. How's she going to find someone to love her, to marry her? How did she rather, how is she having children? Who's going to look after them? You know, not little, they are big life milestones that people look forward to in their lives. And them being put into question, I guess, in my case, simply because my vision is not 100% is, I don't see the correlation personally. Everyone deserves to find happiness and be loved and love someone and have children and, you know, follow their dreams, do everything they want to do. So personally, I don't see the correlation between, you know, your vision being a certain way and living the life that you want to live, apart from no driving, as we've heard today. I'm actually really looking forward to the self-drive cars, really. So I'm just going to double check my notes so I haven't forgotten anything. Yeah, so I think with the barriers that I've overcome, I would say they were more internal barriers that I've put, self-imposed barriers, I would say, like internal battles I would fight with myself. I would say particularly when I have had the flare-ups, or I had the flare-ups, things changing to that extent. You know, you go from, I wasn't 100% obviously, but you go from maybe being able to read a text on the phone to, you know, not being able to, and then eventually I learned how to use screen readers and stuff. Eventually, you know, being able to, it's a whole lifestyle change, you know. I loved reading books all throughout my childhood and into early adulthood. Like I was literally, my nose was stuck in a book. I would go through like 3 books in a week. That's how much I loved reading. I was reading a lot of series. If anyone here used to read Sweet Valley High, again, showing my age, when I was a teenager. So I loved reading. And when that was kind of taken away from me in the way that I was used to, it really affected me, you know, it really affected my self-esteem, my mental health, just everything. Because that's one of my, you know, how you have something that you identify yourself as, like, you know, I'm a mom, I don't know, I love riding bikes, I love hiking, that sort of thing. That was me. I'm a bookworm. And that was gone. So when I had my first flare up, my sister came over and she was like, so what are you doing with yourself all day then? And I was like, well, nothing, I'm just staring off into space because there's nothing much I can do. So she was like, well, you can just get Audible. And that's what she did. She set me up on Audible. And whilst she was doing that, she basically just did the whole thing. She got me a couple books to start off with. And also when she came over, it was maybe 1 or 2 days into my flare up. So I was still figuring out how a screen reader works. So maneuvering, I don't know, like maneuvering Audible, the app, maneuvering apps or the phone or everything. It was a bit of an adjustment as well. But you know, now we are professionals. I'm very good at that, very comfortable. Even if not that we want a flare up to come on, but even if it did happen again, I would still be very comfortable because I've had things like I've done long cane training, so I can actually walk around outside with my long cane. Currently, because I'm in the middle of things, I would say, like I have some useful vision, but not useful enough to use it to be just to be, what do you call it, partially sighted or sight impaired. I'm kind of in the middle. So what I have or what I use is a guide cane, and a guide cane is in between a symbol cane and a long cane. So it doesn't actually roll on the floor. I just kind of hold it in my hand, and it's long enough that I can check if there's any steps or dips or anything in front of me, or if at any point I'm unsure. But I do carry it in my hand folded for the most part, because I think it also helps when you're out there with people, so that they don't really, so that they know, they're aware that you are visually impaired and you may or may not see them. And if you do, you know, well and good, you can maneuver around them. If you don't, they're aware, so they're more likely to give you space, or they're more likely to be what's the patient, I would say. So yeah. Let's see, apart from my guide cane and basically assistive tech on my phone, I've also learned how to use JAWS on the computer, and just basically, I want to say JAWS has made such a huge difference for me, a huge difference for me. Initially, I would only use the magnification. I use a combination of both now, JAWS and magnification. So screen reading has made a big difference for me, especially in my work. I started using JAWS whilst when I started my internship, and I'm not like a professional with it now, not yet, but I am able to use it quite comfortably, and it's made a huge difference. A lot less eye strain. I feel a lot more comfortable doing large amounts of text reading because it's reading it to me. So yeah, I think that's one of the biggest things I've picked up from my internship. It's that there's a lot available out there. There's access to work as well. There's just a lot available out there that, you know, you might not be exposed to if you're not out there, if you're not in the working world. So definitely, as you can see, even with Lavini and everyone, you know, working is something that's well within a person's reach, even when they are sight impaired or vision impaired. So I'm going to finish by talking about being a mom. So I think, as I mentioned, my eyesight did sort of take a downturn after, you know, parenthood begun. So it has been quite the journey. It's obviously a challenge regardless, whether or not, you know, you're a parent, whether or not you're visually impaired. Being a parent, being a new mom, it's a journey, you know, it's something that's different. It's going to have its ups and downs and everything. So having the additional, you know, aspect or additional layer of also coping with my eyesight going, I don't want to say, I keep saying downturn and downhill, but I feel like I've learned a lot from my eyesight, you know, progressively getting worse. I'm still not using the right words, but I think I've learned a lot from, you know, losing my eyesight to the point that I have now, in that I've become more resilient. I've actually I would say I'm a lot more brave, actually. It did take me a while to get here, obviously. It took me some time. I had to do self-work. Those audiobooks I mentioned, actually, they were some self-help books, some books on self-esteem, some books on confidence and self-esteem. But yeah, so things along those lines, that's what I was listening to. And it really helped to kind of build myself back up to, you know, to the person that I know I am, and the person that I wanted to be, and the person that I knew that I could be. I'm still working on me. I'm not saying, you know, I'm there yet, but yeah, so with my children, I think they kind of understand, but because again, I'm in between, when I have flare-ups, I can't see. When my vision is okay, when I'm, you know, I don't want to say in between flare-ups, so when I'm not having a flare-up on a regular day, basically, I can see a bit, or I can see enough to do certain things. I think it might be a bit confusing to them every now and then, or really the whole time, but I think they adapt really well, and they kind of have adapted to how we do things differently. Some things I do is I dress them in distinct clothing. So when I'm able to use my vision, I can kind of tell them apart from other children. They also know that we have our way that we cross the road. You know how most times people will get to a junction that hasn't got any markings, any traffic lights, any road, zebra crossing, nothing, and just that's where they'll cross. for us, we have to go into the, like further into the road and then cross over, and they have adapted to that as well. Like they know, okay, we're not going to cross at a junction. That's just not going to happen, because, you know, how I don't think I've ever explained to them why we're doing that, but I've told them this is what my mobility officer said, we have to do it this way. And they have met my mobility officers as well, so they know. I was naming them by name. This is what so and so said, we have to do it like this because he knows what he's talking about. But yeah, and that's the other thing I thought actually I should mention. Some services I've been able to access have been the low vision service. I think is really important to keep going to the low vision service. They do eye checks, they check the vision or my vision. They maybe give me stronger magnifiers when I've needed them, which they've been getting progressively stronger. They kind of advise me on kind of what's out there really. They might not be able to give them to me, some of these things to me for free, but you know, they let me know, well, you could use this if you want to read, I don't know, big envelopes or something, or bigger letters. You can use this if you want to actually write. Maybe you're writing a, what do you call it? If you want to maybe send a letter and you want to write something, there's actually, like, it's like a square. I think it's called a guiding square, but don't quote me on that. It helps you stay on the line. And I haven't really used my hand. I would say especially my lowercase handwriting. I stopped using that because I feel like it's not even legible anymore. Perhaps it is, but it's just easier to write in capital letters. But yeah, so things like that, basically, they'll give me things to make my life a little bit easier. The other service is the sensory team, or the sensory service in the local council. For me, it has been so helpful being known to them and working with them. Initially, as I mentioned, when I was registered, I don't think I was ready for the I don't think I was ready for the news, maybe, or I didn't really understand it really. So I didn't really utilize the services that were available to me back then at that point. But now I can really tell you it's so useful, it's so helpful, it's so, like, you feel so supported. You just need to reach out to the local sensory team. That's where you sort of get the mobility, the rehabilitation officer who helps with the white cane training. My rehabilitation officer helped me learn the routes to work and back. They helped me learn the area that I lived in, because halfway through I moved as well. So they walked me around the area I lived in, said, this is the nail shop, this is the hair shop, this is, you know, shops that are relevant to me. This is the grocery shop, things like that. So the kids' schools, you know, places that I would regularly need to be going, they walked with me and helped me figure out the best and safest route to go there as well. So yeah, I think I will leave it at that. Yeah, I think I'll leave it at that. I think I've mentioned everything, but I just wanted to say that it's really important to keep track of your eye health, especially if you have an eye condition. And I would say really before starting to drive, because that was nearly a very close call for me. I nearly did start getting out there on the road, and, you know, who knows what could have happened. So yeah, I think just stay on top of the eye health and keep getting your eyes checked no matter what, even if you've got healthy eyes, you never really know. And yeah, so thank you so much for being.
No, thank you, Sylvia. That was really interesting and informative. And I definitely can relate to some of the things you shared, and I'm sure others do. And one thing very quickly is, my kids are teenagers now, but we still practice safe crossing. I don't care how old they are, and I will keep reinforcing that we only cross when there's tactile markings, where there's a pelican crossing or a zebra crossing. I don't even like those island crossings where you're waiting in the middle of the road and potentially you've got cars in front and behind you. That's just so scary. So I don't care how old they are, they're still going to cross safely. So thank you so much for sharing that. And if anyone now has any questions or comments for both Sylvia and Louise, feel free to unmute, pop your hand up, and I'll just check with Minal to see if there's anything in the chat.
No questions in the chat. Some lovely comments. And nobody. Perm's got a hand up actually. Perm.
Hi, Perm.
Can you hear me? Hi.
You can go ahead.
Right. I've got a question for Louise, actually. It's in reference to, it's two questions. A patient is either registered SI, and a question could be asked, would they still be eligible to drive? Because if they do they have to deregister then from being SI? That's one question. And the second question is, mobility scooters, are they safe for anyone with a sight impairment to be riding? And if so, some people do. And I'd like to know why they're not regulated, just like everything else, like e-scooters and everything else. Because some people shouldn't be, even with a sight impairment, are still, you know, under the influence, thinking that they can actually have a mobility scooter. Because if you have an eye condition, you're not safe on the road or on the pavements, surely.
Yeah, no, I thought that question might pop up, and I nearly put it in the talk actually. There's no official regulation of mobility scooters. The guidance, actually, the DVLA do have guidance on their website. The guidance is pretty much the same as a driving license level of vision. I think it's slightly less stringent. I totally agree with you. I think that if you're driving any kind of vehicle on a pavement where there might be small children or people actually who might not see you either, it's dangerous. And we know that there are cases where people have been permanently harmed as a result of collisions with mobility scooters. It is a quite a thorny issue. I haven't got any, you know, solution for that. I think it's something that the government should absolutely be looking at. Anything that's moving at speed, you know, should be restricted, shouldn't it? They should have regulations around it. So I think the unofficial guidance is pretty much the same as a standard for driving, if you're driving a mobility scooter. Your first question was, someone's registered as sight impaired that thinks that their vision is okay for driving.
Yes.
So either they had an eye condition that has subsequently improved, you know, for instance, maybe they've had cataract surgery which has been more successful than was predicted, or they've had some kind of treatment that's improved their vision. They can ask to be taken off the register. They would still have to go through the same level of vision check through the DVLA. So they would still have to notify the DVLA before they could get their license back, and they would have to go through those checks. I would be surprised if anyone who is registered as sight impaired would have enough of an improvement in their vision to be subsequently eligible to drive, because there's actually there's about 3, 4, maybe 5 lines on the letter chart different from being registered as sight impaired to being eligible to drive. So that's a big improvement in vision. I'm not saying it never happens. I'm sure it's possible that it could happen, but it's unlikely. And I think coming off of the register in order to find that out would be a mistake. I think that they should talk to their consultant first, have their vision measured, have that conversation with the consultant, and then decide whether or not to come off of the register and try to get their license back again.
Thank you. Yeah,
I mean,
sorry, I didn't mean to interrupt.
Yeah.
I think a lot of people are still, you know, in denial, but you know, I get asked a lot of questions. I mean, I used to drive, and it was so severe. As soon as the consultant found out, he took my keys off me. He said there was no way you should be driving, which is fine. It's quite harsh, but I mean, a lot of questions always asked if people who have got severe, you know, short-sightedness, and their mind is like 19, how come they still have eligibility for driving?
So
And
that's really interesting. You should say that. It's one of the things that you don't have to notify the DVLA for. So you don't have to notify the DVLA if you're short-sighted, long-sighted, astigmatic, as long as your vision is correctable with contact lenses or glasses. Now, -19, actually, it's likely that someone who's -19 will have some retinal issues that would limit their peripheral vision, their side vision, their visual field. Sorry, try not to use jargon and you slip into it accidentally. But that's a significant possibility that someone who's -19 may not meet that standard and may be registrable as sight impaired. But I've certainly seen patients with -20, 22, I think the highest, that was still eligible to drive, and you know, there's an argument to say that actually the spectacle lenses minify things so much that actually that might be dangerous in itself. But if you wear a -22 contact lens, then that effect is minimized further. So it's, yeah, I see where you're coming from on it. And I think at that level, that person would be monitored very closely. Yeah. Was there anything else, Pam, that you were going to say?
no, thank you. No, you've just clarified so many things. It's just that
Yeah.
you'll always miss, once you've driven for about 30, you always will miss it, no matter how long
Yeah.
the period. But there's clear parameters. People still think that, oh, I'm okay, I'm only going locally. I mean, when you have significant peripheral loss, or any kind of loss, it's always err to the side of caution. I mean, for myself personally, when those little knocks start happening and you misjudge the depth, that's when I think you automatically know that this doesn't feel right, and you should always ask the question.
I think you're right. It's a gut instinct, don't you, really, in yourself? You just don't want to quite believe that. And I can't tell you how many times I've heard someone say it's only local, I just go to the shops. I think if our public transport in the UK was better, then people wouldn't be so dependent on their cars, and it wouldn't be so limiting on their ability to get around. But no clinician takes that lightly in telling someone that their vision isn't good enough for driving. It's, as I say, next to telling someone that there's a problem with their eyes, it's the next hardest thing, really, discussing either not ever being eligible to drive for some young people with RP and those sorts of conditions, or telling someone that they shouldn't be driving home.
Thank you so much. Thank you.
Thanks, Pam. Is there anyone else?
We've got a question in the chat, but Keith has had his hand up for a while. So Keith, do you want to unmute yourself?
I think I'm unmuted, aren't I?
Yeah, you have, Keith.
Oh, right, okay. Well, I'd just like to say thank you to Louise and Sylvia, really informative. I always learn such a lot from these webinars. Before these webinars, I'd never spoken to someone else who was sight impaired. So, I was in wonder. But last time I visited St Thomas's Hospital, I go once a year, they did say to me that it's not worth us giving you an eye test, Keith. And I said, well, surely, I've got cataracts. I've lost the sight in one eye since I've been coming to see you. And I have very limited vision in my right eye, but there is still some useful vision, which I'm clinging on to. But is that right? It's not worth getting an eye test because I can't see out my glasses anymore. And I did say this to the doctor, and the doctor said, well, go to Boots and try some on, and if some work, then you've got reading glasses. And I suppose he's right. He wasn't being nasty or vindictive or anything like that. He was a very nice chap. But I can't believe that I'm not supposed to have regular eye checks still. And I can't get an eye test because whenever I ring up, say, Boots or Specsavers, they say, but are you under another hospital? I said, yeah, I'm under St Thomas's. Oh, you have to get discharged before we can give you an eye test. Is that right?
You know how I feel about that. I'm going to let Louise answer as a professional, and then I'm happy to chip in after.
Oh, thank you.
I can understand why your consultant has said don't don't bother having an eye test. He's probably worried that you might spend out on glasses that are of no benefit to you, and that does happen. People are sent, they they're sold glasses that are not necessarily of any real benefit to them. However, I'm going to caveat that heavily. If your glasses are in poor condition and you do still use them for some function or other, then you absolutely are entitled to have an eye test, and you should be having an eye test, because if you find your glasses helpful, even if it's just to magnify your odd bits and pieces, and they're in poor condition, how else are you going to get another pair of glasses? They're going to fall apart. So I think if the opticians tell you you're under the care of the hospital, so we can't test your eyes, remind them that you're under the care of the hospital for the health, and you don't have a glasses check at the hospital. And then you're entitled to an NHS eye test. The reason that the opticians are careful is because they can actually be done for fraud by carrying out eye tests on people who are under the care of the hospital for their glasses. And I would say that that's quite a small percentage of people. It tends to be people who have a condition called keratoconus or very high myopia, or children. But if you are just going into St Thomas's to have the health check, where are you going to get your glasses from if it isn't the high street optician or your local optician? So I think it's just a case of saying to them, yes, I understand that, but where do I get my glasses from? Because St Thomas's don't do that for me. Now, the other thing that I should say, and I'm going to confess here, is that I actually work at St Thomas's, and I work in the low vision clinic at St Thomas's. That's my that's a job that I do just every so often, just to cover their bank staff for their low vision team. And what I would suggest might be an easier way forward, Keith, is if you just ask your consultant for a referral to the low vision clinic. So if you haven't had a low vision assessment recently, in the low vision team, we check your glasses, and we can give you a prescription to take out to a high street optician. So anywhere else, I would say, well, actually, even if you're someone that was going to Moorfields, if another hospital, it's always worth asking for a referral to the low vision clinic, because most low vision clinics will check your spectacle prescription too. We definitely do up the road at RNIB in our clinic there. And I do at St Thomas's. So any low vision patient I see, I'll check whether glasses will help them. So I think, Keith, probably that's your best bet. Maybe give the ECLO a call at St Thomas's and see if you can get booked in for a low vision assessment. You might not even need your consultant to refer you for that. But it is a big problem, and I hear this from lots of people, where the consultant, for all the right reasons, has said, oh, don't worry about having your eyes tested because the glasses are not much help to you now. But actually what they don't do is think, actually, where else are you going to get your specs? Are they actually helping you? And that should be checked as well. The health obviously is always going to be checked by the hospital, so you're safe in that respect. Nothing's going to go wrong with your eyes because you haven't had an eye test. But for you, the glasses might be worth just pursuing a little further. But Vinia, I can send you the ECLO telephone number if you need it, if you want to share that with Keith, and he'd be able to help you, Keith.
The only other thing was the previous doctor I went to see last year, he said, I'm going to discharge you, Keith. And I wasn't happy about that, so I wouldn't allow it to happen. So
yeah,
it's another thing, it's
I can't answer that too much, Keith, because it's very much based on the individual, your eye health, and sort of how stable your eye condition is, and that sort of thing. I can totally understand your reluctance, because you want to protect your eye health at all costs, don't you? I think it's certainly you've got to do what you're comfortable with. And if that's staying within the hospital all the time, you've got the choice to do that. Just tell them that. It is a difficult one, I think. Sometimes it's, again, sort of well-meaning, because they don't want you to have to keep trailing in unnecessarily. But if it's reassuring you, then I think that's it's good that you felt confident to sort of stand up for yourself and say, no, I want to keep coming. But people who have been discharged, and I, you know, obviously then a regular eye test in the high street is absolutely essential.
Oh, that's lovely. Thank you very much for your help.
You're welcome.
Thank
Thanks, Louise. Mina, you said there was something in the chat.
Right, there was one more question from Wendy asking, are there any rules regarding cycling when registered sight impaired?
Mm.
Oh, that's a good question. There are for motorcycles, for sure. There are definitely for motorcycles. I don't know. I'll find out for you and I'll share that information with Bhavini once I've found out. Not that I know of. That's the answer. Not that I know of.
Yeah, but we'll get back to you. Thanks, Louise. Thanks, Wendy, for your question. Is there any other question in the chat?
No, no other question.
No. Okay, whilst we're waiting to see if there is anyone, just a quick reminder of tomorrow's webinar, which is all about digital eye care, which will cover screens, eye drops, dry eyes, workplace policies, and how to manage inputting your eye drops, especially also if you have more than one eye drop that you're using or have been prescribed. If there isn't anything in the chat or nobody else has any more questions, then we're going to put the poll up, and if as many of you as possible could complete the poll, that would be really helpful to us to ensure the topic, the content is relevant and useful to you all, and it just helps us plan future webinars. So if you're able to, please do complete the poll. Is it on our screens yet?
Yeah, it's just come on now.
Come up. Okay, thanks. Whilst people are completing the poll, Mina, do you just want to read a few comments from the chat?
Yeah, sure. So Mary says, evening everyone. Neil says, awesome speaker. Manu, very informative program. Thank you very much. Mary has said, great informative talk. Angela has said, it's amazing and thank you. Eamon has put up an insurance document with regards to, let me just read it out for you all. This is an extract from my care insurance document. You must tell us straight away if anything changes to the information you provided as per the statement of insurance. The changes include the following, and if you do not tell us about these changes, this may result in increased premiums, refusal of a existing, refusal of an existing condition worsens. You can find additional information in the driving and transport section www.gov.uk, or pick up a leaflet called D100 from the post office.
We'll put that in the information along with the other
Correct.
resources mentioned today, along with the webinar recording once it's available. So if you're not able to access the chat, don't worry. All the links and website details and information that Louise has shared and will share, we'll put that link in the information that we send out to you all. Thank you. If you've managed to complete the poll and you don't have questions or comments, thank you so much for joining us today. And we hope you found it useful and informative. And again, just really want to say a massive, huge thank you to both Louise and Sylvia for presenting and sharing their lived experience with us today. Thank you so much.
Thank you. Good night, everyone.
Thank you so much. Thank you.
Thank you, everybody. Bye.
Thank you very much. Thank you. Bye-bye.
Bye.
See you tomorrow. Bye.
Tomorrow. Thank you. Bye.
Bye.
Yeah, good shout. It's not Thursday this week. The 6th and final webinar is tomorrow.